Now today we'll be talking about CT scan of the abdomen. Now it's very crystal clear that this is the CT scan of the abdomen because we are all saying the abdominal organs. Now you can very nicely make out this is the vertebra. This large organ is liver. We must know that on the CT scan, this side is left, this side is right always. So this is left and this is right. So we have liver on the right side. So the largest organ of the body of 1.5 kg, this is all a liver. So we can see this is all liver. This is liver. This is also liver. This is also liver. Now you must know that this liver and spleen, they have same echogenicity or same density, radio density. So this is the liver, and you can see this portion on the left side is spleen. So they have same echogenicity on sonography, and they have same radio density on CT scan of the abdomen. So you can say this is liver and this is spleen, and they are more of a uniform. They are more of a uniform. So this is liver on the right side, and this is spleen on the left side. Spleen is very important because from the spleen we can trace pancreas. We must know the pancreas tail approaches to spleen's hilum. So you simply need to find the spleen, and if you want to trace the pancreas, you will get pancreas here. So this is all portion of spleen. This is all portion of spleen, and this is the here. This is all component of pancreas. So we'll come to pancreas later, but before that, I'll tell other things also which are there. Uh, we must know on both the sides we have two kidneys. So this is kidney and this is kidney. We can very crystal clearly see these are the two kidneys, and this we must know that in the kidney the hyperdense or dense white structure is kidney stone. So kidney stone is made up of, if it is made up of calcium, it will be hyperdense. It will look just like bone, like this. This is bone. So this small white structure is renal calculi. So it is non-obstructive calculi because if it is obstructed, we can see hydronephrosis or dilatation of this pelvic calyceal system. We must know that kidney has a structure, the renal pelvis, through which kidney drains all its urine into the ureter. So this is the pelvis system, renal pelvis system. So if there was some stone, it should have been dilated because of the hydronephrosis. And if it is an obstructive stone, then the stone is usually in the center and it will occupy all the renal pelvis or the ureter, and there will be dilatation. So this is non-obstructive renal calculi in both the kidneys, and we can see the hyperdense or dense white structure which is renal stones. The other things we must understand is when you see very closely here, what you see is this black structure, or this black structure is all fat. This is all fat. This is all obesity. You can simply see here also. This is whatever black structure you are able to see is all fat. This yellow white, the yellow tapping is all fat. This is all fat. So fat appears black on the CT scan. And the most black structure on the CT scan is air. So this you can see is all air. This is air, and air is present in the intestinal coil. So this is all gut. This is all intestine, where the food, because of the digestion of the food, there is production of the gas. That is the reason why this is very dense or very black. This is all air. So this is fat, what we can see. This is all fat. And when we see water, water also looks more of a black in abdomen. So when we call it as a free fluid in the abdomen, we label it as ascites. So what is ascites? It is a free fluid. Why it is free? Because it can move from one place to another. If it is not free, it will not move. So this ascites fluid blackishness will be slightly blacker than the fat, but less compared to air, because water is more dense than air, and we can see ascites here. Just focus on these two areas. Now I'll take a different color. So this is all fat, but here you can just make out, here there is accumulation of water between this fat and the rib margin. On the left side, on here, you can see that this is the margin, and behind that, this is all water. There is all accumulation of water. So this is free fluid. This is typical ascites. So this is ascites. You can trace it here also. You can trace it everywhere. So here also, this is ascites. You can see this. Here also, there is very nice rim of ascites. So this is ascites. Apart from that, we can see pleural effusion. As we know, this is abdomen. From when liver and spleen start, it means we are coming into the abdomen. When liver and spleen ends, and heart and lungs start, we call it as we are coming into the thorax. So what we can see here, this is a portion of liver just above the liver. You'll get diaphragm. On the left side, this is all air. This is all air. This is a part of actually lung. This is all part of lung because we are entering into thorax. So on the left side, what we can see, this radio density is a very typical of water. This radio density is very typical of water. So this is basically pleural effusion. This is a very typical density of water. So there is actually left-sided pleural effusion. This is left-sided pleural effusion. We can compare this density to a organ. You can compare this radio density to this. This is liver. This is a solid organ. This is bone, and you can see it is much blacker or radiolucent to the liver. So this is typical pleural effusion. And this is pleural effusion because it is on the dependent part. Patient's back is on this side. So patient is lying down. These are the vertebrae. So patient is sleeping on this. It means this is dependent part, and this free fluid or this fluid has taken the concave shape. This concave shape is around the rib margin, around the lung margin. So it means it is pleural effusion. And the most important thing in this CT scan film that I wanted to show is, we know that we always have to trace this spleen. This is spleen. This is spleen. This is spleen on the left side. And usually pancreas is a very well localized organ. And in this image, the pancreas is very blurry. The margins of the pancreas, it is not very crystal clear. It is very blurry. And a pancreas appears enlarged. And the most important thing is when we see the images, suppose here, everything looks well sorted. And this is all fat, and there is no fat stranding. One of the most important thing for inflammation. Whenever we want to say inflammation, we always say that there is infiltration of neutrophils, lymphocytes, chemokines into the structure. So whenever there is inflammation in the abdomen, there is infiltration and there is fat stranding. Fat stranding means this black fat gets whitish lines because of the infiltration by the neutrophils, lymphocytes. So in here there is no infiltration. That is the reason why this fat is very blackish and looks very decent. But in this image here, when we see that, just compare the fat over here this fat looks okay. There is no infiltration of anything. Here also, it looks okay. There is no much of a fat infiltration. Here also, it looks okay and decent. There is no fat infiltration. Here also, there is not much fat infiltration. But see here in this area. So in this area, this fat looks very much disturbed with the fatty infiltration. So this is this whitish, all these whitish streaks is basically fat stranding, means inflammation or infiltration by the inflammatory chemicals, inflammatory cells into the fat. We call it as, what we refer it as, fat stranding, which is a very typical example of acute inflammation. So it is all around the pancreas. So in this case, it is actually acute pancreatitis, which is causing inflammation around the pancreas. That is the reason why the pancreas appears very shabby, the margins are irregular, and there is infiltration of fat around it. And you can get cyst, you can get necrosis part will appear very much black compared to the density of this pancreas. You can get cyst or accumulated um, collections also you can get if there is necrosis, inflammation around. But we can very crystal clearly see there's infiltration into the fat. See here, all the fat is very hazy compared to fat which is present here. So this is very much inflamed, or there is infiltration, and that is because of the pancreas, because the pancreas is the organ which is present here. It looks enlarged, the margins are abnormal. So this is very typical example of acute pancreatitis, because we can see that pancreas is very much enlarged, or pancreas is enlarged, and it is showing signs of fatty infiltration. It is present with ascites, which is bilaterally, which is present in a very mild quantity. It also has inflammation and causing pleural effusion. So pleural effusion, ascites, fatty infiltration. This is very typical classical history of acute pancreatitis. So thanks for now. We'll meet again with a new topic.